You're watching InTechnology. This episode is one in a series with innovative companies who are part of the Intel Capital portfolio. In these conversations, we'll explore the key areas of technology Intel Capital invests in to shape the future of compute.
Hi, I'm Camille Morehart, host of InTechnology podcast, and very much looking forward to a conversation today on silicon photonics and application for it in personalized medicine. This is an Intel Capital Series podcast, so I'll be co-hosting with Srini Ananth, who is Managing Director at Intel Capital and focuses on deep tech, cloud infrastructure, and AI applications investments. He's led investments in all of these areas, and he also serves as director or observer on the board of Astera Labs, Ayer Labs, Common Sense Machines, Elion, InWorld AI, Verisim Life, and SiPhox. Welcome to the podcast, Srini, and please introduce our guest for the day.
Thanks, Camille, and it is great to be here. Today we have a great guest. Mike Dubrovsky is someone I met almost 4 years ago, actually right after COVID hit and we were all in lockdown, and I happened to join a YC demo day. And that's when I met Mike and his co-founder, Diagnostics, for the first time. But Mike has a very eclectic background, as I would put it. He has an academic background in material science, and he's spent time doing research at both Technion and MIT on biochemistry and photonics applications. He's founded companies in energy tech right out of college. He's worked on a nonprofit that used a very innovative silicon photonics concept for cryptocurrency. And so there is the energy efficiency angle right there. And currently, he is the CPO and Co-Founder of SiPhox, an amazing company that is using silicon photonics and the economies of scale to affect personalized medicine, personalized diagnostics. And we're great to have you here and looking forward to some amazing discussions here.
Thanks, Srini. Excited to have this conversation.
As Srini mentioned, SiPhox is using silicon photonics in the devices that it makes, and I know the technology is applied in a variety of different industries. But before we get into how you're using silicon photonics, could you describe for us what it is and how it works?
Silicon photonics is really, it's like transistors used to be these vacuum bulbs, right? So it's in terms of optics, like at some point there was all like bulk lenses and things like that. And eventually a lot of things went to fiber optics. So confining light in glass or other fibers with a shell, and you confine the light based on the refractive index difference. So the only difference with silicon photonics is that it's all being done in silicon structures or other chip scale structures. And the really big difference there is that in optics, alignments are very difficult, and any kind of small variability can cause a lot of losses. It's not like electricity where you can take two wires and touch them to each other in any direction and you're going to get electrical current flowing pretty efficiently. With optics, very small alignment. If you've ever seen a picture of, there'll be an article like Beijing University builds an optical quantum computer or something, and it's like this optical table or 7 optical tables, which are all with lenses and everything, and they're aligned perfectly. You look at that and you think, oh my God, these grad students probably spent like 3 years aligning all of these lenses, right? The great thing about silicon photonics is that you get all of those things for free from lithography, because the way chips are made, you have extremely high accuracy of the sizes of things and the alignments of things relative to each other. And so when you make these, if you're able to fabricate successfully waveguides and other structures, like basically fiber optic cables, but made of silicon on the chip, you can start making all of these components in a circuit that's already pre-aligned, already pre-connected. So you don't have to worry about all the connections and the alignments and all these things. And also the precision of the components normally is very expensive, whereas in the case of a chip, you get the precision almost for free from the lithography equipment. So that's the promise of silicon photonics, and I think it's really been very successful at that for telecom, which is probably the biggest market for precision optics and lasers and so on, at least at low power.
But at SiPhox, you have very different use cases. So you're actually offering at-home test kits where people can test biomarkers in their blood, like for cardiovascular health or issues with thyroid or hormonal or nutritional health, right? So this is putting you both in medical as well as consumer spaces, which I think is interesting compared with some of the other use cases. So before we dive deeper into that, can you briefly explain how silicon photonics is actually utilized in the testing that you do?
In the case of silicon photonics, it's a resonant optical structure, so it's something that absorbs a certain wavelength of light. In academia, people will attach proteins to it and make a sensor out of it. So the one that's been successful historically is called surface plasmon resonance. So what that is, a glass slide with a very thin sheet of gold on top, and they shine light underneath, and the reflection of that light, the angular reflection, changes when proteins attach to the surface. So if you have proteins there and a liquid and something is attaching right at the surface, you're going to get a change in the reflection. And that's actually a very commonly used technology. That's used in pharma. So what they'll do is for example, if you look at an antibody drug, you inject the person with a protein and it binds something in their body and blocks it or activates it or whatever. A good example is Ozempic is a peptide. It's like a short protein that binds something like a receptor in your body that stops hunger. The way that they actually screen these things is they will attach your receptor. So they'll take the human receptor and they'll put it on that glass slide chemically, and then they'll flow different peptides over it. And when they bind, you can see that in the reflection of the light. Instead of using a large glass slide, it's taking a tiny component on a silicon chip, but doing the same thing. You attach proteins to it, and when those proteins recognize another protein, you see a shift in their resonant frequency.
Thank you for explaining the science, Michael. And can you now talk a little bit more about SiPhox's tests and devices?
Basically, we realized that with the progress that's been made in silicon photonics, it's possible to commercialize it for the home. The overall idea is just to take some of the standard blood tests, the protein and hormone blood tests that are available now from LabCorp or Quest, and make them extremely easy to do at home. So it's not just making a chip that does that, but all the readout equipment, like the laser, all the optics that connect to it, everything, all of that can be miniaturized into a consumer electronic. We decided that was a very good direction for the company because one of the strengths of chips is that they're very scalable. If you're doing a diagnostic that's used in a central lab, the scalability is not very important because actually there are not that many central labs. So the most important thing is that the cost for a single test is very low, but the machine can actually be very big and expensive. But the ability to make it a consumer electronic is very valuable if you're going into the home. We already were thinking, okay, would be super exciting, putting silicon photonics into every home, potentially even onto every arm, right? So going all the way to something like a continuous glucose monitor, but for proteins. And then during COVID, it just became clear that there's going to be a device in everyone's home at some point. There's so much momentum behind that. And so we committed fully to the at-home use case and just making something super low cost. And that really plays to the strengths of silicon photonics. A lot of the previous ideas for improvements in blood testing really centered around a faster result at the doctor's office, which doesn't really change the paradigm that much. We were excited about, okay, we hate our healthcare experience. Like everybody we know hates their experience with healthcare. What is one way that would change? The major way to change that would be to have testing at home and enable all these other like workflows that people want to do, like telemedicine and tracking yourself. And there are myriad of things that you can do if you have a home blood test. And so that's how we ended up working on what we're working on for the last 4 years at SiPhox.
So Srini, why is Intel Capital interested in this?
What I had seen, I've spent about 6-7 years in photonics. We've made investments in photonics. Is seeing the applications in photonics driving advances in telecom, driving advances in data communications. And so when I met SiPhox, it was a very cool application. I hadn't thought about the healthcare application. I hadn't thought about the diagnostics application. So when I met them out of YC, that was very intriguing that they brought a concept which is miniaturization and economies of scale that come from going into semiconductor processes, and then bringing that to a very different field that doesn't rely on miniaturization. There have been companies that have built laptop devices or laptop devices, right? These are large devices that sit in point-of-care facilities that can do pretty gold standard tests, but nothing of this type exists at home. At home, the best you get in terms of biomarkers are your CGM, continuous glucose monitors, and you have digital biomarkers with Apple Watch and all of your Garmin and other devices. So I think what we saw in that was bringing the biomarkers and bringing that digital quantification to the home and bringing the same gold standard to the home at a price point that consumers can afford, right? And what that does is, if you think about the way you manage your healthcare, you go once a year, you get a physical, sometimes you get the lab referral. Almost a third of people don't even go to the labs, don't even get their test. Another third of the population probably gets the test but doesn't care about the results that they get because there's no good way to track these results. They sit in a database somewhere in a LabCorp or a Quest, and then you don't refer to it until a year. So what we saw with SiPhox was application of silicon photonics to bring a consumer-grade device at a consumer-grade price point, but with all the validity and the accuracy of a lab test, and giving you information about your hormonal biomarkers, about your health biomarkers, all those things that you would care about and you would constantly want to monitor. And with Mike and Deirdre, we saw a team that had the diversity of experience, had brought the experience from photonics. And for this was a very logical progression to here's a new application. We understand the photonic space, and there are ways that Intel Capital and Intel can help. And so that is the other angle where Intel Capital always looks at how can we go beyond capital in terms of materially helping the company? Can we advise them? Can we provide them the components? We've had a great partnership with Mike and Deirdre here, and we really look forward to the application and what SiPhox can bring to the home. I think there are applications in chronic patient healthcare monitoring. If you think about companies like BioPharmas and others who have been trying to provide like patient monitoring at home, the SiPhox device can be something that provides that data points that a medical professional can use to monitor patients with chronic healthcare conditions. So that's our thesis. We are very selective in our healthcare investments. And so when we find teams and opportunities like this, we are very excited.
Most people are already familiar with a number of at-home tests, including like COVID or at-home pregnancy tests, just over-the-counter purchases. I understand this is different because it's using silicon photonics, but can you explain what it is that you're doing that's more nuanced than providing these simple singular kinds of tests?
So there's a difference between like quantitative tests and on-off tests. So like your pregnancy test just tells you you're pregnant. It doesn't really tell you like how pregnant you are, right? And the same with COVID. But if you're measuring something that really the number matters, and for example, if the number is 20% higher, you have a problem. If it's 20% lower, you're fine. That's where it becomes an order of magnitude or 2 orders of magnitude more complicated to provide that test accurately. And that's why today in the home, you really only have glucose. There are a few others, but really what's available broadly is glucose monitoring, and glucose is the highest concentration thing in your blood, essentially. What people were able to do is to use electrochemical sensors, which are like electrodes with some enzymes on them, to get quantitative glucose to work in the home in a very low-cost form factor. And that's the glucometer, that's the continuous glucose monitor that people wear on their arms. Unfortunately, that approach doesn't really scale down. So once you get to like proteins and hormones, which are lower in concentration, it's not possible to use that approach. Every single test that you get, like blood test that you get for proteins and hormones, is run on a large optical instrument. And so really that's why the leverage is in miniaturizing the optics. A lot of what's been done over the years is trying to get that electrochemical readout to work for proteins and hormones, but it hasn't been successful just because the physics don't work well. And that's why there's no electronic readout really in the lab. Everybody's using optics in the large lab tools.
So we already talked about the fact that using silicon photonics in testing is a somewhat novel approach, but as I understand it, your way of market testing your at-home device was also a bit novel. Would you talk a little bit more about that?
We came into this as outsiders, so we weren't coming from Roche or Abbott, or there's just a few players in the industry for blood testing and this kind of thing. And we really tried to think from first principles, like how do you enter this market successfully? There's like a graveyard of various devices that people have built, mostly for point of care, not for the home. And some of them are successful. There are also some really strong successes, but it's definitely not a high hit rate space. And we tried to understand why and what we could do differently. And so trying to understand what is that going to look like, who will be the early adopters, who's going to come next, and so on, I think is very important. And we weren't really satisfied with the standard process of doing market discovery for diagnostics. And so what we did is this was a very difficult decision because it's an enormous undertaking, but we essentially launched a preview version of our product. We took off-the-shelf technology and built what's called a mail-in test. It's a card that preserves the sample, and you mail it back to a central lab and they run tests on it. And so these tests already exist in the market. We basically just built a souped up version of it. So you can go on like one of the standard companies, Let's Get Checked. They'll sell typically a couple of biomarkers in a single test. So we decided, okay, let's do a preview of what would it look like in a world where you can get 17 of these in a single test. We launched an entire business around it. Initially, it was really market research, like trying to understand where are the use cases, what do people want to buy? Because oftentimes, if someone's willing to pay for something, it's just worth 10 or 100 times more in terms of information than if they say, yeah, like in 5 years, I would use this. It turned out to be pretty successful. So we grew it into kind of a standalone relatively large business with thousands and thousands of users, and we're still learning a lot from it. One of the things that it allowed us to do is really hone in on which biomarkers we want to target first through our approvals, because we can see like where the demand is. We also have real data from tons and tons of testing where we see which biomarkers are actually valuable in a clinical sense. People are using these biomarkers to optimize their health or to get early warning signs of chronic disease and so on, like which ones are actually useful. And so it's taking the literature and kind of recommendations from experts and actually comparing them to empirically, what are we seeing when we test people? It's definitely not the typical way of doing it. So far, we think it's actually been really instrumental for us in forming our plan for how to go to market with the hardware. And it's also been a great way for us to just engage the healthcare industry, because I think it's often very difficult if you're making hardware as engineers. How do you engage with the actual healthcare establishment or researchers and so on? Because your product is several years away always. So it's having something to engage around that's right here, right now. Okay, do you want to use this now? If not, why not? And that really creates the valuable conversations that allowed us to make strategic decisions about what to commercialize.
So I think there's generally concern in the world now at this point, after people have been wearing all of these personal fitness trackers, sending data into the cloud or a variety of clouds, and also even the genetic testing that so many people are doing, that where is the privacy, and what about cyber hacking, and what about eerie future potentials like you've collected my DNA and now we have tools out there like CRISPR, and you combine those with things like AI, and what could be done in the future with all of that information that I may or may not even be aware of. Biohacking. Could you talk a little bit about what kinds of measures you're taking to address, or I don't know, consider these kinds of scary future worlds?
I think DNA is a lot more risky than blood testing, because blood testing, all the markers are pretty generic. Like you can't identify somebody based on a blood test generally. So I think with DNA, it's a lot more fraught. At some point, it does make sense to price insurance based on your blood biomarkers, right? So that's where it becomes, but I think that's really should be like an opt-in thing. There are some insurances which price car insurance based on your driving habits, right? So I think from that perspective, there's a positive possibility of being rewarded for staying healthy and so on, like in a data-driven way. I think in general, the status quo with healthcare is so bad. Cost versus performance, I would say, like that curve is not going well. So I think it's clear that at some point there's going to be a lot of AI plus technology improving this situation. And so I think really the data story is very positive. I think the privacy part of it, there are a lot of laws around this and they're very strict. So I think that privacy is like what people think about a lot, but I think the really important thing is if we don't start using the data and we don't start automating this, it's only going to get worse. Some interesting examples are if you take certain specialties for doctors, the number of patients is increasing while the number of doctors is decreasing because they're retiring. So there's just like this completely upside down situation. So you basically need to go in the direction where you take, let's say, the top 20% of doctors and just scale them up, right? Make the best people able to see way more patients in some way, right? Even if it's several layers removed and so on. But I think you can also see this in terms of lifespan. So like the average American lifespan has plateaued and is maybe even going down. But if you look at like top 1% earners lifespan, that's still going up. So it's not that we're getting worse at medicine, we're just getting worse at providing it at scale. So I think in many ways, the data story is like the opposite. It's not the scary story of I'm going to lose my privacy or whatever. I think that's all solvable. And there's a lot of concern about it. So it'll probably be taken care of reasonably well. The question is, are we going to be able to leverage all this data to actually improve the situation? I'm more afraid of that not happening. I think it's absolutely worth like the minor privacy risks to actually make a fundamental change to the way healthcare is delivered. And so I'm pretty optimistic about it, I would say.
Any final thoughts, Srini?
It's risk versus the opportunities and the benefits that you can get from it. The risk is, of course, yes, what if I lose my biomarkers or my biomarkers are leaked and someone else uses it? But I look at our healthcare system is broken. We all accept that. We live with that. But you have so many different systems. You have 2 or 3 large EHR companies and our records are all siloed and locked in. So I can't really carry my records from one place to another. They make it so difficult. I have no trends. I'm not able to derive any insights from all of these digital data that identify me. And so when I don't get any benefit from it, it's great that it's all private and it's all locked up, but I really don't get any benefit from it. And in this day and age, when we're making all these advances, why aren't we able to see those benefits? I'll even take the case of in the doctor's office. We complain about the doctor doesn't have time to spend with the patients because they're taking records all the time. They're typing in notes. And we've been looking at companies that can do transcription, for example, within the doctor's office. But even things like that, you can bring in AI and you can make their life easier. So if they can spend more time with the patients and you can interest some of those tasks, we can do a lot better job. And so this is where open standards around interoperability, around exchanging data between your specialist and your primary care provider, between your diagnostics provider and your primary care provider, all of those has to happen. And if you're someone who uses the Apple Watch, for example, or in the Apple ecosystem, you're starting to see some of those integrations where the apps that you use for your fitness and your healthcare apps are tying into the Apple Watch ecosystem. And of course, people trust Apple because of the privacy element. And you entrust this company with a lot of your data. You give them the permission and you see some value from it. Ultimately, if you don't see value, you wouldn't care. I really think it comes down to measuring what is it that you can benefit from it. And I think open standards in the past has helped with privacy, being sharing the right interface, sharing the right standard format, and everyone adhering to the same security and privacy standards. That ultimately helps.
Mike Dubrovsky, co-founder of SiPhox, and Srini Ananth, managing partner at Intel Capital. Thank you very much for today's conversation. I found it very interesting learning about photonics and also the future of personalized medicine and ongoing health monitoring.
Thank you, Camille.
Thank you very much.
Never miss an episode of InTechnology by following us here on YouTube or wherever you get your audio podcasts.
The views and opinions expressed are those of the guests and author and do not necessarily reflect the official policy or position of Intel Corporation.